Welcome everyone to today's webinar. My name is Layla Moomin and I am the Community Engagement Coordinator for the Canadian Cancer Survivor Network. Thank you for attending today's webinar entitled What Men Told Us, Prostate Cancer Survey Results. CCSN is pleased to welcome our presenter, Filomena Servideo, President and CEO of Colorectal Cancer Resource Action Network. In today's webinar, Filomena will be reviewing the results of CCSN's National Prostate Cancer Survey based on the recently released Prostate Cancer Survey Report. The webinar promises to be insightful as it will identify and highlight the overarching themes that resonated consistently throughout the survey results from survey correspondents. The results will be presented according to the patient, survivor, and caregiver perspective, who all provided meaningful and thoughtful input. Join us as we learn more about the prostate cancer journey and the need to better inform and support prostate cancer patients and their caregivers in Canada. At the end of the presentation, our speaker will answer your questions. However, at any time during the webinar, please feel free to type your questions into the window at the bottom right of your screen. For those of you who have not attended an earlier webinar, the Canadian Cancer Survivor Network is an organization working with cancer patients and survivors to learn about health system complexities, connect with others to plan action, and act to promote best care and healthier survivorship. If you would like to learn more about CCSN, please visit our website at survivornet.ca. This webinar is being recorded and it will be available tomorrow on YouTube. In addition, the slides will be available on SlideShare. Links to both will be sent to the email you provided. Now I will turn things over to our presenter. Welcome, Filomena.
Thanks very much, Layla, and thank you to CCSN for inviting me to deliver this presentation on their National Prostate Cancer Survey results. I was pleased to have worked with CCSN on this project for many reasons, not the least of which was my family history with prostate cancer. I watched my paternal grandfather go through a rather difficult journey many, many years ago. And while treatment options have definitely increased over the years, what men had to say about their journeys was quite astounding and reflective of some unmet needs across the continuum of care. So with that said, I warmly welcome each and every one of you to this webinar today. What Men Told Us, the Prostate Cancer Survey Results, and I'd like to call up the presentation now. And here we go. Okay. Webcam closed. Okay. So let's take a look at the presentation outline for today. We will talk just a little bit about prostate cancer in Canada. We'll examine the CCSN and prostate cancer survey that they employed across Canada. We'll review the survey results according to the following 5 sections. Just a little bit about the survey demographics and general information. Part B will look at the patient and the treatment and treatment-related challenges that patients face. Part C will look at the patient and accessing supportive care, which turned out to actually be one of the unmet needs. Part D will look at survivors and some of their unmet needs. And Part E will look at the caregiver, which has definitely been determined to be an invaluable but overlooked perspective. And finally, we'll summarize the 3 recurring themes that were discovered throughout the survey results. And then we'll definitely spend a little bit of time on your questions. So about prostate cancer in Canada. According to the Canadian Cancer Society, prostate cancer is definitely the most commonly diagnosed cancer among Canadian men. 22,900 men were diagnosed with the disease in 2019, accounting for approximately 20% of all new cancer cases in men. It's the 3rd leading cause of death from cancer in men in Canada, accounting for 10% of all cancer death. 1 in 9 Canadian men will be diagnosed with prostate cancer in their lifetime. Most prostate cancers are diagnosed or expected to be diagnosed in men over the age of 50 years. And there's a dramatic variation in prostate cancer incidence across the country, not necessarily due to differences in risk, but likely due to the use of PSA, the prostate-specific antigen testing. And what research is showing is that survival rates have definitely increased over the years, resulting from two things. One, improved screening tests, and two, more treatment options. Men are winning back their lives as a result of this. So CCSN wanted to see how men were doing. They wanted to actually gauge their perspective. So to help capture that patient and caregiver perspective on the prostate cancer journey, spanning from diagnosis to survivorship, CCSN employed a thoughtful and comprehensive national prostate cancer survey through SurveyMonkey from September 12th to October 3rd in 2018. And the purpose of that national survey was to help the prostate cancer community better understand what prostate cancer patients, caregivers, and survivors actually go through during their transition from diagnosis to treatment, to follow-up, and finally to survivorship. The objective? Take those key messages that are found in the survey results and utilize them in an advocacy campaign designed to improve the quality of life for prostate cancer patients in Canada. Based on the journey that patients go through from diagnosis right through to survivorship, try to do something about improving their quality of life in Canada. So after reviewing the survey results, the survey report findings were organized according to the 5 following sections. Question 1 to 6 focused on survey demographics and general information. Questions 7 to 22 focused on the patient and the treatment of prostate cancer and the identification of treatment-related challenges. Questions 23 to 29 focused on the patient and supportive care as an unmet need. Questions 30 to 43 focused on survivorship and how to best move forward. And finally, questions 44 to 49 focused on the caregiver as an invaluable perspective that is often overlooked. So this is how we will move forward in this presentation, looking at each section and highlighting some key messages in those respective sections. So let's start with the survey demographics and general information. The survey had a total of 137 respondents, which was a fairly robust sample population. 134 respondents were from Canada, with the exception of Northwest Territory, Yukon, and Nunavut. Every province had respondents. And truth be told, not surprisingly, 40% were from Ontario, 24% were from Quebec because they account for the largest provinces in Canada. 3 respondents were from outside of Canada, 1 from Florida, 1 from Texas, and 1 from Australia. 59 patients responded who were in active treatment, 64 survivors responded, and 14 caregivers responded, all for a total of 137 respondents. This was a pretty big sample population, so we got to gauge what they had to say about their prostate cancer journey and about the caregiver journey as well. In question 3, 80% of patients were diagnosed between the age of 51 to 70 years of age. And once again, this is not surprising because cancer is most commonly diagnosed in men over the age of 50. 86% of patients and survivors had their disease diagnosed or alerted through the PSA testing, followed by digital rectal exam, description of symptoms, and blood work, and all were eventually confirmed through a biopsy. In question 6, patients were stratified according to where they were in their disease journey. The disease stage distribution ranged from just diagnosed to stage 4 patients. So you'll see at the bottom of that pie chart, 8% were just diagnosed, 20% were in treatment, 14% were stage 1, 16% were middle stage, 12% were stage 4, 16% had a high PSA test, and then 22% accounted for other. And that other category identified patients who experienced a recurrence, as well as patients who assumed a watchful waiting approach. And we're going to talk a little bit about the watchful waiting approach later on in the presentation. So let's go to the second part of the survey, questions 7 to 22, that focused on the patient, treatments, and treatment-related challenges. There's no doubt that the management of prostate cancer has definitely improved over the past 20 years, and it's resulted in improved patient outcomes, and the death rates have definitely gone down, 2.8% per year since 1994. And treatment improvements are largely due to the introduction of hormonal therapies known as ADT or androgen deprivation therapy for both early and advanced stage disease, as well as advances in radiation therapies. But patients who continue to undergo therapies are still challenged. They continue to face things like treatment-induced toxicities, bad side effects, coping with long-term side effects of treatments. They have fears of recurrence, and they have self-esteem issues. These are the issues that were thoughtfully addressed through the CCSN survey questions in this section. And patients provided really great input. They did not hold back when it came to providing open-ended replies following each question. These are the most commonly reported side effects from prostate cancer treatments such as surgery and radiation therapy. These side effects appear in the literature and are consistent with the side effects that were reported in the survey results. So here we have, for example, problems achieving or maintaining an erection that are known as erectile dysfunction. It may result when men undergo surgery or hormonal therapy. We have leaking urine, also referred to as urinary incontinence. It can happen when men undergo surgery or radiation therapy, and sometimes when they have an enlarged tumor in their prostate gland that can block the flow of urine from the bladder. That happens as well. Problems with their bowels, such as diarrhea or abdominal discomfort from cramping and gas that can happen from radiation therapy. These are all treatment-induced side effects that can reduce quality of life, and patients struggle with these side effects if they're not properly managed. In question 9, 36% of patients selected significant side effects of treatment as an issue that they face from their prostate cancer treatment. One of the open-ended replies was side effects of treatment, while not severe, are impactful on quality of life and mental health. Question 7 results identified sexual function and incontinence as the most notable treatment-related issues. Here are just some of the open-ended replies that were furnished. I feel good, but my sex life is not. I suffer from involuntary urinary incontinence, and I must change my Depends diapers at least 4 to 5 times daily. Following treatments, issues with bowels, bladder, and sexual function. Question 13 asked patients to specifically list the main issues they faced once their treatments were completed. 34% selected significant or long-term physical side effects of treatment, and 14% selected psychological mental issues. The reply, the open-ended reply furnished was severe urinary and bowel issues continuing 17 months after completing treatment. So more men are choosing to manage their low-risk prostate cancer today through watchful waiting. What is watchful waiting? It's also known as observation, and it's a management option that's intended for prostate cancer patients such as older men who may be too frail to undergo therapies, men with serious health problems, men who are not likely to benefit from treatment such as surgery or radiation therapy. And it's also a way of monitoring prostate cancer that isn't necessarily causing any symptoms or problems, because it's a slow growing cancer that can be kept at bay. And the whole point is to keep an eye on the cancer over the long term and avoid treatment unless the patient becomes symptomatic, at which point the treatment can be initiated. Question 11 asked patients if they assumed a watchful waiting approach to the management of their cancer, and 46% responded yes. And they went on to describe if there were any downfalls to assuming such an approach. And these were the replies they provided. Always on your mind. Concern of it getting worse while waiting. The first year is difficult waiting for the PSA results, but the more it is stable, the more relaxed I became. Always wondering if it is getting worse or spreading. Just knowing that you have this little time bomb. And then finally, question 19 results identified fatigue, bowel and bladder functions, worry and stress as the barriers in their return to work after treatment. And you'll notice the 3 out of those 5 were treatment-induced side effects. Question 21 asked patients about their main health concerns post-treatment. 50% selected a lack of sexual intimacy and impotence. 36% selected fatigue, as well as incontinence, as well as spreading of cancer to the bones. 30% selected long-term effects of treatment. I mean, there's certainly a pattern that's developing here, and 24% selected insomnia. One of the open-ended replies that was furnished from patients was, future treatments, when necessary, will severely impact sexual health. Hormone treatments kill libido and result in impotence, irreversible after extended treatment, among other significant adverse effects. Question 22 asked the advanced stage patient what their key concerns were in terms of the management of the disease, and 4 areas of concern were identified by this patient population: proper care, pain management, family support, and end-of-life support. And some of the rather sobering replies that were furnished to highlight the concerns were as follows: no pain now, but worry about it being in the future. Also not sure how far spousal care will continue in the future towards end of life. How to accept all of this and still plan for future without giving up and having someone that loves you has helped me live. I just wonder what is available to me after I finish the current treatment I am on. And finally, a difficult question. I hope the chemo and hormone treatment will help in the long run, or give me a chance of living out my days in peace of body and mind. The next part of the survey, questions 23 to 29, focused on the patient and accessing supportive care services. Prostate cancer patients face a host of treatment-induced issues that can impact quality of life that result from treatments. What type of treatments? So they undergo radical prostatectomy, and that's the surgical removal of not only the prostate gland, but the tissue surrounding the prostate gland, radiation therapy, and hormonal therapy, androgen deprivation therapy, ADT, which is systemic therapy. These treatments can definitely impact patients, not only physically, but psychologically as well. Two of the most frequently reported treatment-induced side effects, not only in this particular section, but throughout the survey results, were sexual dysfunction, which is a problem achieving or maintaining an erection, and urinary incontinence, leaking urine. Patients struggle with these side effects because these side effects can significantly compromise a patient's quality of life. What we're noticing more and more is that supportive care programs can help a patient meet the physical, emotional, and practical challenges associated with the prostate cancer journey, especially in helping them meet and deal with side effect challenges. The literature has identified the following points on supportive care programs. Supportive care programs can furnish 1, information-based support, and 2, psychosocial-based support. When it comes to information-based support, it can provide information to newly diagnosed patients on treatment options, information that deals with sexual side effects on treatments and sexual rehabilitation, information on the management of treatment-induced side effects, and information on how to lead a healthy lifestyle during and post-treatment. And when it comes to psychosocial-based support, services can help patients who are experiencing anxiety, fear, isolation, and distress that can result from a prostate cancer diagnosis or from the treatments that they're receiving. Psychosocial-based support can be invaluable to patients because it can bring them out of a sense of isolation and loneliness, despair, and help them talk about their disease with ease and confidence with others that are going through the same journey. They can feel empowered again and in control, a control they felt they surrendered the day they were delivered their diagnosis, pardon me. So question 23 results identified the issues that patients faced when trying to secure support for themselves or their caregiver. And these are the issues that were experienced by patients when trying to secure that support. First and foremost, a lack of knowledge of what is actually available and not knowing who to call, geographical remoteness, not being able to get enough respite care hours, trying to adjust to home care options and availability. And you'll notice that there's an other category. And that other actually consisted of how to gain access to support groups. They just didn't know how to do it. They didn't think that they were available to them. They couldn't gain access to specifically prostate cancer groups, support groups. And one of the open-ended replies that was furnished was, I have contacted local support groups, but none have had my kind of treatments, so got no response. Met with a provincial cancer counselor. He only suggested I journalize feelings. I did not find that to be remotely useful. Question 24 asked if rehabilitation services were offered during patients' treatments, and 64% responded no. Question 24 specifically asked patients if they have any unmet needs they would wish to have addressed through cancer rehabilitation, and patients provided open-ended replies which once again dealt with treatment-induced side effects. We're starting to see a pattern develop here, ladies and gentlemen. Maintaining physical fitness, rehab management of symptoms, Would be nice to have more local support from people having gone through the same cancer. There is a local support group, but it is highly insignificant. Management of symptoms, primarily pain management and urinary side effects. Managing ADT side effects. Management of symptoms, sexual health. So sexual dysfunction and urinary incontinence were the two unmet needs that patients wished to see addressed through cancer rehabilitation, and they expressed a need for support and management of these life-altering side effects. Question 28 asked if there were any additional issues that impacted the patient, prostate cancer patient, and these were the issues that they identified. The first, provision of supportive care for patients, and two, access to accurate information on the management of the disease. The provision of information can be quite empowering for patients because it can assist them when it comes to helping them understand their disease and helping them understand their treatments. So information on the management of the disease can be delivered by, for example, healthcare professionals, nurses, and charities, patient groups. Here are just some of the many open-ended replies that were furnished. Because men are less inclined to seek support and create supporting networks, we have to rely on our physicians to get maximum information. As most of them are overextended and busy, it is very difficult to get proper information and support. Sexual health, impotence, coverage of erectile dysfunction drugs. Having access to someone initially to put the situation in perspective. Hearing you have cancer and then waiting to obtain good, reliable information is difficult. I can just imagine someone with a more serious case that would be life-threatening, very scary. 1, how to decide which treatments to have, and 2, what to expect during treatments. Education about the disease and its idiopathology. So briefly, to summarize, in this section of the survey, patients highlighted the need for supportive care to 1, handle treatment-induced side effects, specifically sexual dysfunction and urinary incontinence. 2, include accurate information regarding the management of the disease. One patient actually commented, I think people today rely on Google to find out the information they think they want, and it is not always the best information. And finally, gain access to emotional, psychosocial support services to help address fears, anxiety, and distress. So the fourth part of the survey, questions 30 to 43, focused on survivorship and how to best move forward. Every year, more men in Canada are surviving prostate cancer, and much like I said before, they're winning back their lives due to better screening methods and more treatment options. This is ultimately resulting in higher survival rates. While this is encouraging news, survivors of prostate cancer are often faced with having to manage difficult, lingering side effects from the treatments they endured for their disease. So this is why questions 30 to 43 focused on the issues faced specifically by survivors. The months and the years after treatment is known as the survivorship period. So when side effects linger, a new set of challenges emerge, and support is absolutely required for men as they're moving forward during the survivorship period. So question 30 results identified treatment-induced side effects and psychological mental health issues as the main issues faced by survivors. So you'll see that 71%, right underneath the pie chart, 71% of survivors selected side effects of treatments as the main issues faced during the survivorship period. And 33% selected psychological mental health issues, followed by finally change to family dynamic. And some of the replies furnished: because radiation virtually destroyed my prostate, I am impotent and no longer able to maintain an erection, as well as extreme incontinence, change pads 3 to 4 times daily, and minor urinary incontinence, erectile dysfunction. Something that we found rather interesting, but it was most certainly not surprising, when survivors were asked what they found most helpful in the healthcare system during and post-treatment in question 35, the themes that emerged in Part B, according to the patient perspective, also emerged from the survivor's perspective. So what they found helpful was information on treatments and side effects, supportive care for treatment-induced side effects, meaningful relationships with healthcare professionals, and supportive care for emotional and psychosocial support. When we asked survivors to identify determinants of quality of life when living with prostate cancer in question 37, not surprisingly again, what ranked in the top 3 were urinary incontinence, sexual dysfunction, and survival. Those ranked among the top 3. And then that was followed by psychosocial support. And then what made it in the top 3 in the other category were bowel function, fatigue, and I believe it was healthy lifestyle, assuming a healthy lifestyle. So issues that resonated with survivors throughout questions 38 to 43 consistently over and over and over again dealt with the following 4 themes: access to information on treatment-induced side effects, access to supportive care services to address unmet psychosocial needs, access to rehabilitation services to assist with side effects, again, and promoting national awareness of prostate cancer and the utility of the PSA testing. The last section of the survey focused on the caregiver, and that was questions 44 to 49. There's no doubt the prostate cancer diagnosis can be just as equally frightening for the caregiver as it is for the patient. Who is the caregiver? A spouse, a family member, a friend, or a loved one. And the role of the caregiver can be absolutely extensive, for they can serve as a medical translator for the patient, an information specialist, a financial advisor, a psychosocial expert, and they're continuously assuming care for the patient, of the patient. They oversee household chores, they care for the family, and all the while they're usually maintaining a full-time job. The role absolutely commands respect as they undergo enormous challenges supporting a man with prostate cancer regardless of disease stage. 14 caregivers responded to the survey in a very thoughtful and informative manner. And that's what this last section deals with, identifying the unmet needs of the caregiver. Question 44 asked caregivers, what are the issues you encounter caring for someone with prostate cancer? And you'll notice that a whopping 77% selected emotional drain and or trauma for the caregiver. Insomnia was number 2, 69% selected insomnia, as well as hours spent in medical appointments. lifestyle changes, physical fatigue, ongoing worry about prognosis, management of side effects, inability to plan ahead, hours spent on medical information seeking. These are all highly, highly relevant and deeply impactful to caregivers and family members. And it begs the question, where does the caregiver seek support for themselves? 54% of the respondents selected through friends and family and reading books and/or websites. No one selected a patient organization, no one. The rest of the respondents selected they don't seek any type of support for themselves whatsoever. Just a few, I think 2 selected through their faith, and I think there was one who selected psychologist. Question 46 asked caregivers, what support services could be improved upon for caregivers and individuals with prostate cancer? And the most popularly furnished open-ended reply, 62%, was to be made aware that there are organizations and support groups. The need for supportive care services was clearly top of mind for them. Here are some of the open-ended replies that were furnished. I wish there was a support group for caregivers close to where I live. Prostate cancer group meeting at the hospital, meetings with other caregivers. When asked what issues they encountered in securing support for themselves or for the patient in question 47, 46% identified a lack of knowledge of what is available, and 23% identified not knowing who to call. And this was actually consistent with the patient perspective as well. Question 49 asked caregivers to share additional information, and 5 themes emerged. Inadequate provision of information by treating specialists, which we've certainly heard before. Emphasizing the adoption of a healthy lifestyle in the management of prostate cancer. Accessing online prostate cancer forums for moral support for women and caregivers. Furnishing caregiver with superior knowledge base and understanding of palliative care services. Advancing prostate cancer awareness, particularly in smaller cities and towns. And that was consistent with the survivor's perspective as well. So, let's take a look at some of the overarching themes. After reviewing the results, 3 critical themes resonated consistently from the patient, survivor, and caregiver perspective. And those 3 overarching themes were assistance dealing with treatment-induced side effects, provision of supportive care services, timely access to treatment and information on the management of the disease, including information on side effects. These resonated, these were present throughout the patient part of the survey, throughout the survivor part of the survey, and the caregiver part of the survey. When it comes to assistance dealing with treatment-induced side effects, just recognizing that these side effects are life-changing, can reduce quality of life, can increase anxiety, and managing these side effects will be, according to patients and caregivers, will be immensely helpful in reducing stress for patients. When it comes to the provision of supportive care services, access to supportive care services can help patients, survivors, and caregivers in 3 critical areas. Handle treatment-induced side effects, specifically with respect to urinary incontinence and erectile dysfunction. They can access accurate information regarding the management of the disease, and they can gain access to emotional support or psychosocial services to help address fears, anxiety, or distress surrounding therapies. And finally, when it comes to timely access to treatment and information on the management of the disease, including side effects, the provision of information and supportive care was tied to that access. And these are essentially the points that were made throughout the survey results. Proceeding to a timely consult was fraught with anxiety. Provision of information on prostate cancer was not timely. Need to access treatment in an expedited fashion. Acknowledge care burden on caregivers and provide access to support. Felt unprepared for severity and duration of treatment-induced side effects. And here are the last thoughts. The report obviously identified some unmet supportive care needs and information-based needs. And providing men with supportive care services can just bring them out of a sense of isolation and loneliness and provide them with tools so that they can speak with confidence, with ease, and allow them to exchange ideas and tips with other men who are going through the journey. The hope is that all stakeholders will come together to support the prostate cancer patient and their caregiver to ensure that they are living a productive and meaningful life. Thank you, ladies and gentlemen. For a copy of the full report, please visit the Canadian Cancer Survivor Network website at the following link, and you will gain access to the report that contains all the highlights of the survey findings. Thank you.